Welcome back to my channel, AI True Scale. This is Sirisha Ross, your host. My guest today is Michelle Bolton, founder and CEO of Mobile and Emergency Health Profile. The most dangerous moment in healthcare might be the simplest one. A paramedic kneeling next to someone who can't speak, trying to figure out what medication they're on. My guest today had that moment happen to her. In her 30s, a surgeon told her, "I don't know if I can save you." She survived, spent years recovering, and then did something unusual. She stopped waiting for the healthcare system to fix the information gap that nearly killed her and built the fix herself. My 911 is a waterproof QR code wallet card that gives first responders instant access to health information you choose to share. No app, no login, no waiting. Let's welcome Michelle to our show. Welcome, Michelle.
Hello and hi. Thank you so much for having me. I appreciate it. Nice to be here.
It's pleasure is all ours, Michelle. So we want to really understand what this My 911 card is about and how did this journey begin for you?
Okay. Well, yes, thank you. I might provide a little bit more context to help your listeners understand. I had a number of emergency surgeries in my 20s where they were emergencies and the doctors didn't know anything about my situation at the time. Well, luckily enough, I really wasn't on any medications at that time that that I'm on today. And even today, I'm not really on very many. So it's great. But when you're in those situations for emergencies, there's a lot of emotional turmoil, and for not just yourself, but for the people around you. And you are correct. I did have an emergency surgery when I was 30 years old, and I was diagnosed with a very large teratoma in my chest. And what that is a very large tumor. And it took up my entire chest cavity. So I ended up having to have open heart surgery and basically get my affairs in order and, say goodbye because, as you had mentioned, the doctor didn't know if he could even save me at the time. So, I was in great shape. I worked out all the time, ate all the right stuff and, really took care of myself. But, even when we do those things, health is health and our bodies can become very unpredictable if something's kind of brewing inside that you don't suspect. So I never felt any pain at the time. I didn't know that I even had this issue. It was in me for a very long time. And so I ended up having to have open heart surgery and did say goodbye to my family at the time. And there was a bit of a recovery afterwards. Thankfully, I was in great shape, Sirisha, so it did not take quite as long for me to recuperate as it might have after that surgery. And fast forwarded to 2018, and they started screening me for breast cancer. So I was going in for repeated appointments and, again, answering all of those same questions that, you're typically asked when you go for an appointment. Who's your emergency contacts and what medications are you taking and what are your allergies and what are your underlying conditions and things like that. And it gets really frustrating when you're going in week after week for these appointments and, that you're constantly asked the same questions and, from department to department, you're repeating yourself all the time. And, when you're scared and you are not feeling well, it gets really annoying and really frustrating. So I came home and basically decided to create our customized wallet cards for healthcare that would basically bridge the gap between having to answer all those questions every time I went for an appointment, or like you said, in the event there is an emergency, then that information is readily available, right? So it just streamlining emergency medical communications is the priority for the company. And, to give people the tools that they need to empower themselves and empower the people around them to help them in those times where they may not be able to help themselves, right? It's easy for you and I to sit here and have a conversation. We feel great and everything is wonderful. But if, let's say you have a fever of 103 and, you're nauseous or you've broken something or you're bleeding somewhere. And, there's a lot of different situations, obviously, where you're not going to be thinking clearly. You may not be able to remember or recall the information that they need to be able to diagnose you properly or avoid any medical complications through potentially giving you the wrong medications and that sort of thing. So what the service does is it bridges that gap for people, and it allows the patient to basically prepare that information in advance and have it in their wallet when they need it. So emergencies aren't planned events, obviously. They are emergencies for a reason. And, having that prepared information in advance helps everybody around you, speeds up the process, avoids potential errors that, you don't want to have any reactions to drugs. Certainly if you have, life-threatening allergies, that's a major issue, right? So
Right.
that's our job, is to empower patients and help them advocate for themselves and the people around them.
That's awesome, Michelle. Like the idea itself is like really, I know like you did unusual, as I said in my introduction. Like I mean like everyone thinks that, oh yeah, healthcare needs to be better, like why should I do this? Why should I do that? But again, having a solution to a problem, that's like amazing. That's beautiful that
Thank
you are
you.
able to do that. And the follow-up question is like how does that work? Because I've been in that same situation.
Mhm.
So I can relate. So I was going to the hospital for radiology or any MRI. So every time they ask me about all these questions, they're like series of questions. Do you have a living will? Do you have this? Do you have insurance? Do you have all this? So explain me how this card is going to help someone like me.
Okay, so we all have a different medical profile.
Hmm.
And if you were to sign up for the service, basically, then you have a specific profile that you get to customize. You get to fill in those really, the details that you need them to know about, again, that they're constantly asking you about. So if you have, for example, if there is certain medication that you don't want to take, or let's say, you didn't want a blood transfusion or something like that, you would have to, you're controlling all of the information that you're entering, so that, because only you know what that looks like
Right.
for you, right? And
Right.
so you take on the role of basically your own caregiver role,
Hmm.
and you get to share the information that is important for you. And in those events, again, let's say you were unconscious and you couldn't speak for yourself. If you've put that particular information in your profile,
Hmm.
when they scan the QR code and that'll pop up for them, then even your husband, or let's say your mom was to help you,
Hmm.
they don't, they wouldn't know what your wishes are. They wouldn't know, um, about that specific information. Only you really know what you want to share, right?
Right. Right.
So, but you're taking on the responsibility of the information that you are sharing.
That you're
So it is
putting.
100, that responsibility is yours. And if there's something too sensitive you don't want to share, then you don't share it. It's
Mm.
as clean as that. But I mean, there will be, depending on the provider, the healthcare provider, I can't speak on a legal um, through a legal lens on that. But they may say, we need written authorization from, an attestation from your lawyer or legal healthcare power of attorney,
Mhm.
whether or not you want, to be resuscitated or things like that. Like I can't
Mhm.
legally speak in those areas.
Mhm.
And that is something that the healthcare provider will advise you of, what they need and how they need it.
Okay.
But I think if you are able to share your solution, my 911 solution, with your family or the loved ones who might be taking care of you,
Mhm.
if you needed that help, you explain your wishes to them, you let them know, and you show them what you've put on your card. Because if they're going to be taking care of you, then,
Right.
if you go through the profile, you enter the information that you want to share and
Mhm.
show them, this is what I've got. This is why I'm printing this, or,
Mhm.
putting this on my card or on my profile,
Mhm.
and that they clearly understand. So if that situation never comes up, then it will help them at least speed up the time. The provider may still want additional confirmation from your lawyer or
Right.
your your legal power of attorneys, things like that. But I think the most important thing is to remember that you have the ability to control the information you are sharing,
Okay.
and make sure that, you are putting that information in there, that it is critical for them to see, that they're always going to ask you anyway.
Right. 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 And how are you following the regulations? Because I know, like, if it's a patient data and any medical form of
Heavily.
data, yeah. So
Yeah.
I think the
Yeah. No,
regulations are
heavily. Yeah. That's number
everywhere.
one. obviously, yeah, the privacy is, first and foremost, obviously. And,
Hmm.
we've got certain pillars that we go by for every decision actually that we make. And that's, obviously regulation and compliance, privacy and security.
Hmm.
But once those key, metrics are met, then it's all about the patient experience for me. It's all about
Hmm.
keeping it simple,
Right.
right? For the members to use, keeping it easy for them because they want to be able to, go on with their life. They don't want to have to worry about learning a whole new program. This is so easy. We've intentionally made it
Hmm.
very, very simple for people to use. And then if they're traveling, and something happens, they can, if they had a new allergy, if they were traveling somewhere else, they could just jump in their account, update their profile and save it.
Correct.
So
Yeah.
flexibility, right?
That's another question I had. Like, do you send any reminders? Because people forget, right? So they might have
We do.
um,
Yeah.
subscribed 5 years ago, and things might have changed after that. They need to get reminded of like, hey, are you okay? I mean, like if you're not hearing
Yeah.
from them, yeah, you expect that everything is okay. And again, I think it's the saying, right? Like
Mhm.
just take it, and you might not have used it for lifelong, but again, it's a protection that it's more like an insurance, so a life
Well,
insurance,
and
like you take it.
yeah, yeah, you make a really great point too, because we do send out, to your point, we do send out regular reminders, friendly reminders. Please be sure to, well, even
Hmm.
when the clocks change, whatever it is, usually about 4 times a year, we send out friendly reminders. Please check your emergency profile to ensure it's still accurate. If anything's changed, well, it
Hmm.
might be a good idea to update that in the
Right.
event there is an emergency. Yeah, we do send out the reminders, but you make a really good point because if people forget, you know,
Hmm.
how are they going to even remember if an emergency did come up and they didn't have anything prepared,
Right. Right.
right?
Yeah.
They're
Yeah.
not going to know. Or if they've had to be evacuated due to, we've had wildfires here in Canada.
Hmm.
When people are evacuated, or even if there's hurricanes down in the States, that sort of thing, are you going to remember what you need to bring with you?
Yeah.
So it is important to keep your profile up to date. It is
Hmm.
important to make sure you list everything you would want in there in the event, let's say you did have to evacuate.
Hmm.
All you do is bring your card, right? You're going to bring your wallet.
Hmm.
You'll have your wallet card in your wallet. And if you had to go to, live somewhere else for a temporary period of time, you have that information. You can go to the local pharmacy and say, I need this. I
Hmm.
wasn't able to bring this at the last minute, or I ran out, or I've lost it. You can show them what you've
Hmm.
been taking, and then they can call your doctor right from there and request a refill or a replacement for you. But at least it's giving them some insight into
Right.
exactly what you're taking, right?
Right.
Yeah.
And so another follow-up is like you said, Canada, right? Are you,
Mhm.
is this available for US residents as well?
It is. I I'm yes, and it's under
Hmm.
my911life.com.
Okay.
So that's the US side. The Canadian side is my911.ca.
Okay.
So yes, it is available in the United States. Right now it's in Florida, but I think it'll be launched everywhere pretty well pretty soon. So super
Okay.
excited about that. There's a lot of healthcare systems that have different types of programming, like systems that they use
Hmm.
and processes that they have in place already. So we are not replacing any of those systems. We're basically filling the gap, right?
Correct.
And providing a tool that can bridge the gap between the patient and the provider. So we don't replace their systems. We don't, connect into their systems. We just fill the gap for them.
Okay. Okay. So yeah, that's what I was kind of like. I was thinking about this after I talked to you first time. I was
Mhm.
thinking about like, how about like you standardize it? Like right now, everyone, whenever you go to a hospital, the first thing they ask you is for your driver's license. And the second thing
Mhm.
is your insurance card. So I kind of feel like this is very important, right? Like the information, the gap
Yeah.
that you're filling. If everything is in like one spot, everything is tied. Because right now, like with AI, you can do that. Like you can integrate different systems into one big database or whatever it is, like one hub where it gives you
Mhm.
everything. So, I mean, like the information that you're providing, the gap that you're filling is like significant. and especially when during the
Yeah.
emergencies. So I
Mhm.
kind of had an idea like, hey, why can't you just put this QR code on some kind of government ID? You integrate with them, and it's basically right there for everyone to use it. And you never know.
Well, you never know, but it's also there's a lot of, I know a lot of people I've talked to, they want control over their information.
Mm,
They don't want anybody else taking that control away from them. It's very private information. And there's been a lot of trust issues in healthcare ever since COVID.
mm,
So, I hear a lot of those comments and, they love the fact that this is under their control. They manage it. They get to manage what they share. They get to control their own information. No one else owns it. They own it themselves. Whereas they don't want, someone else owning that information and they don't know what's going to happen to it.
mm.
So it's a very personal choice.
Yeah.
And I just think it's going to be different for everybody.
Mm,
Their information is different. They don't want to be mandated to share certain things.
mm,
There's a lot of personal situations, and the stories I've heard are they're quite they're quite private. And
mm,
I'm very grateful people have shared their information with me
mm-hmm.
because I'm obviously a vault. It doesn't go anywhere.
Right.
But they express their concerns about data security. They express their concerns, especially with
Correct. Yeah.
when it comes to governments and things like that, who's controlling it? Where is it going? What's happening to it? Will
Mm-hmm.
they, what will they do with it? So they don't necessarily want it government run. They want their own individual ownership on this.
Yeah, I hear that point because I was basically coming from, hey, you know what? If there is an emergency, people will know exactly, and the data is completely.
Yeah.
And I'm only coming from my experience, right? Some people might have different cases that they don't want to share. So if there is some kind of like
Absolutely.
a substance abuse or like they don't want to disclose some of the things. Okay, so those are okay. That's what I
Absolutely.
was. Yeah, I think that's I mean that's true too, and it's a private matter that they don't want to go
Mhm.
public with it. So okay,
Oh no,
that's a
absolutely.
good.
And they don't want it out there because there's
Mm-hmm.
sometimes I just recently heard a story last week and it was a girl and she's really frustrated because she suffered some medication trauma
Mm-hmm.
that affected her neurologically and she doesn't want to share that, right?
Right.
And when it's on her chart, there's a stigma and she's treated differently and she doesn't like that. So, there's a lot of different issues, I think, if there's been
Mm-hmm.
potential suicide attempts, if there's been mental health disorders, if
Right.
there's been like there's just a lot of
Different
sensitive
types.
situations that people have gone through that they do not want to share. And if you're
Mm-hmm.
going for a throat infection or an ear infection, you don't need to see that other information, right?
Right. Right.
They
Right.
just need to see the most important information that will affect them for that appointment. So they can
Mm.
go in and update and change and add and subtract anything they want at the time for
Yeah,
their online profile.
that's a very interesting point, Michelle. I think I totally missed it because every time I go, my chart basically says I have a stroke history, and I don't want to disclose that to my dermatologist because for
Well, it's not
different.
if it's not necessary.
Yeah, yeah. That I see a good point. Okay. Yeah, my question was clarified.
Yeah, like there's just a lot of very sensitive issues that I think
Mm-hmm.
people don't, they just don't want to share and don't need to share really,
Right.
unless it's obviously in relation to that situation. So, yeah.
Hmm. Okay. So, who is the person most likely to buy a My 911 card today?
I think anyone who wants to be prepared in advance, anyone who wants to be empowered, number one, because we all have to advocate for ourselves anymore. The healthcare system is really struggling.
Mm-hmm.
And, there's shortages in staffing, there's resources that are really tight. This is about empowering people to advocate themselves in a much more efficient way than what they can or do now.
Mm-hmm.
So, because we have to answer those questions, either we're filling out forms and answering the questions from department to department to department,
Mm-hmm.
or you can have this done in advance. So you're answering the questions. It just depends.
Right.
Do it now in advance, have it done once, and
Mm-hmm.
update it as you need to, or continually do it every
Mm-hmm.
year, every time you go to the doctor. Like, it's up to you. You're going to have to advocate for yourselves. So basically, anybody that wants to be really organized and prepared
Mm-hmm.
in taking care of their health, if it's important to them, if their health is important to them or to their loved ones, they are, this is for them. And if you
Mm-hmm.
have aging seniors with the onset of potential dementia or Alzheimer's or Parkinson's, anything, right? Then this is really good because it allows them to keep their independence if they go, but you can control it for them if you
Right.
need to. When the time comes, you can take over the profile as their legal power of attorney for healthcare, and you can maintain the information for them, and they just have to carry their card. So it's really easy
Right.
for them,
Right.
right?
Yeah. Yeah. Sure. What keeps someone renewing year after year on a product they hope to never use?
Well, you know what? I think it's peace of mind. I think it's peace of
Sure.
mind because you can't predict health. And, just like we need, car insurance, we pray we never have to use it, but
Mm-hmm.
it's there in case we do. This is no different, but this is your body.
Right.
So to me, you and I have both been through quite a bit.
Mm-hmm.
We know how important it is to take care of our health. We know how difficult it can be
Mm-hmm.
when you are not well. And I think it's peace of mind. I think it's because it's ease of use. It's just easy, right?
Mm-hmm.
And it's just a small thing you can do for yourself or your loved ones that will, give you a tremendous amount of peace at the end of the day because you just don't have to think about it. You don't have to try to remember things. You don't have to worry about, oh my God, did I tell them the wrong thing? Or
Mm-hmm.
will they really listen to me? And even your loved ones. I know families that their husbands and wives, they don't know anything about the other person.
Mm-hmm.
How can they help them if they don't know?
Right. Right.
Right?
Yeah. True. True. I think it's just something that you need to maintain for yourself and just do it
Yeah.
religiously and update it so you have that you can sleep well during the
Yeah, it
nighttime.
doesn't take long,
Yeah.
right?
Right.
It
Right. It's
doesn't
just
take
a
long.
yeah. It's kind of like you just do it once, and if nothing happens, good. You don't have to even update it. It's kind of like right there for you.
You're good. Exactly. But you know what? In the event that maybe you get in a car accident, maybe like you don't know, right?
Mm-hmm. Mm-hmm.
Like anything can happen to any one of us. And, you could be in a restaurant and there's like 200 people in the restaurant. But if something happened to
Mm-hmm.
one of those guests, could anyone around help them? Right?
Right. Right. So,
Anything, you know?
so what is like the approximate amount of the people that they're using? How often that they get into emergencies? I think I pray like none, but emergencies happen.
Well, you know what? That's what you pray is that they have it but don't need it. It sounds a
Mm-hmm.
little counterintuitive, but it's like I said, it's like house insurance and car insurance. You never want to use it, but you need it.
Mm-hmm.
I think what's really important is, everybody's health profile is so different. So
Mm-hmm.
it's really difficult to say. I mean,
Right.
I've gone to an appointment where I've used my card 3 times in one appointment because every time I went to a different department, they asked the same questions. Nothing was connected. But then I've had members that have had to go from hospital to hospital and department to department in a weekend,
Mm-hmm.
right?
Mm-hmm.
So, I mean, there's a lot of different situations for it. It just depends on your health. It depends on, everyone's profile is different. I mean, it doesn't matter how often they need to use it. It's there for them, right?
Okay. Okay.
So,
Makes sense. Makes sense.
yeah.
So, what changes when a long term care facility or airlines become a partner instead of individual subscribers to your business?
Well, you know what? When we get into that area of partnering with those types of organizations, that will be basically separate conversations because I have to figure out, I want to listen to them and I want to try to understand what they're looking to achieve. Number one, what's important to them. That's what I need to find out. I can customize the service for them however I need to, but I need to understand
Mm-hmm.
exactly how we can best help them through what their needs are. So it's nothing different than sitting down with, a client in wealth type thing, to find out exactly what are their wishes, what are they looking to achieve,
Mm-hmm.
and what are the results they're looking for. And we can structure it around whoever and however we need to.
Mm-hmm.
But I prefer to have those conversations with them and really gain a really in-depth understanding of what they're looking to achieve so that we can be the best partner possible to them.
Yeah, that's good. So yeah, you need to get the requirements first to implement
Yeah.
or give the solution. So yeah, that's nice.
Yeah. You never want to assume that they're looking for a specific outcome. I'd rather listen to them and hear what they have to say and find
Hmm.
out how we can solve their challenge, right?
So you're basically open to expand in that
Oh,
section.
absolutely. Absolutely.
So what was the hardest part of taking Canadian health product across the U.S. border? What are the challenges that you faced?
Well, it's all about regulation, right? I mean, the United States has a very different system in healthcare, and the regulations are very strict as well, the same as they are in Canada, but they're just different.
Hmm.
It's a matter of making sure that we adhere to those policies and all those regulations to ensure that we're safeguarding the data for our members the best we can, obviously. So it's always
Yes.
about regulation and compliance, right?
Right.
That's number one.
And it differs between the country to country. It's like not one
Yeah.
fits everything. So yeah, you just need to
Yeah.
make sure.
And even within the United States, every
Every
state is
state.
different,
Correct.
right?
Correct.
So, we have to be very careful and we have to be cognizant of making sure that we're meeting the regulations for each of those states. Yeah.
Yes. True. So, what's the one thing that would unlock the next stage of growth if you could solve it tomorrow?
Hmm. The next thing that would unlock the stage of growth. I think it's partnerships. I think it's, the marketing is always fun to do. I love it,
Hmm.
but I think it's just building greater awareness
Okay.
and building strategic partnerships
Hmm.
that we can help one another, and in turn it's a win-win-win. It's a win for my 911, it's a win for the healthcare organization or the retirement home or whoever it is, the cruise line, the airlines,
Hmm.
but it's also a win for the patient, right, and the caregiver.
Right. Right.
So it benefits everybody. It's just a matter of how you go about and setting it up and structuring it for people. Again, sitting down, listening, hearing what people have to say, what's
Hmm.
important to them, either on an individual basis or an organization. So, we can serve them the best by listening to them.
Awesome. Yeah, that's a good way to go. So, what does AI belong in the 10 seconds after someone scans your card? Mine.
Well, AI, we're just kind of peeking through that window. I think there's a lot happening in AI right now, and it's a bit of the Wild West out there. So I think that it's going to take some time for the regulatory environment to catch up to figure out
Hmm.
what that looks like in healthcare, because, there's a lot of controversy around it, I think, and there's a lot of
Hmm.
uncertainty around how it's going to affect everything at the end of the day.
Hmm.
So we're very careful around using anything like that in our
Hmm.
service. We just really haven't gone there yet because we want to make sure that, when that time comes, we're being very, very thoughtful about it. And
Right.
again, the service is based on the client and giving them the power to choose.
Right.
So we'll definitely be incorporating it at some point.
Hmm.
And, we're looking into that now and how best we can kind of apply it to the service. But again, I'm being very, very thoughtful around it. I'm taking it baby steps. I don't think there's a rush.
Right.
I think it's more important to always pay attention to the patient first
Hmm.
and to make sure that we're doing the best we can for patients before just jumping in to say we're first on that.
Right.
Because
Right.
there is a lot of questions around it still.
Right. And there is like, especially in healthcare, there's like a
Yeah,
lot of scrutiny because you can't
a
go
lot.
wrong. You can't, I mean, especially when you're dealing with the privacy and regulations, you
Yeah.
need to be cognizant of the data and like everything
Mhm.
around it. And as you said, the patients are the one who are going to dictate. But again, right now with AI, I think what at least to a point where it's kind of saving time for the people who are providing the service. At least that's where
Mhm.
it went to and gone to, where, how can I use AI to reduce? And most of the people that I talked to, everyone said note taking is one thing that they're using.
Yeah.
That's
That's what I
that's
That's what I have heard as well, is that when physicians are tied up in, appointment, back-to-back appointments,
Hmm.
it's the notes.
Yeah,
And
right.
I've heard the very same thing.
Yeah, so I think the note taking is what everyone kind of adapted. And again, it's just a tool, right? It's not like a replacement or you're going to rely. And again, it's not even to 100% yet. So it's just like how can you use a new tool and adapt to a new technology to make our lives better. So it's just that
100%.
concept. And it's also
Mhm.
about the awareness, right? It's just like the card that
Mhm.
you said, people need to aware of the importance of it. It's just the awareness of AI. Where can I leverage it in the day to day that I'm
Exactly.
doing? So it's yeah, it's nothing more than that. I think we still have like a lot of things needs to change before we get to a spot where like do this job for me. It's not yet there. It's kind of it's yeah, we still but I just want to get your opinion about it. So where you're using it and if you're using it for any business development for the product that you have.
Well, we're just diving into all of that right now. So once we get it all sorted out, I'll let you know.
Yeah, yeah, no, interesting stuff.
Yeah, it really is interesting. I think it'll be a great tool, depending on how you use it again. But
Mm-hmm.
for me, I'm really very cautious because to me, it's all about compliance and
Right.
safety and security. And I think people are still uncertain about all of that.
Mm-hmm.
So I'm just being very, very thoughtful before I just dive right into something like that. Right now, we're not using it,
Mm-hmm.
but we're looking into it to figure out the best ways to move forward.
Okay. Yeah, my little story is like 5 years ago. I don't know if you remember this. Cool. When you're having a search engine, it used to say
Mhm.
every little app or website used to say powered by AI. So I think it still
Right.
says that. Whenever I used to see that, I was like a little skeptical. I'm like, what are they
Right.
doing? And I
Well, it's
think I
because we
think
don't know.
yeah, we don't know. And again, like everywhere that I see, I used to notice that. And last few years, I kind of like, if someone is coming up with a new technology, you need to at least be aware of it. You need to
Mhm.
understand what this can do for your lives. Because now, like, you don't want to be behind the trend. You always need to move with the trend. So I think that's what I'm kind of like coming up with. Like, okay, you know what? Whatever there's a new tool, I need to at least read about it just to see what
Oh,
it.
absolutely.
So yeah, that's where I am coming from.
Mm. No, I think it's always good to be informed and to keep learning for sure.
Hmm.
Because if there are ways to improve for, again, the benefit of members, I'm absolutely all in for that. But I'm being very careful about it because I know there's a lot of skepticism around the regulation around AI and how that is affected when it
Hmm.
comes to healthcare, right?
Right. Right.
So I think they're still working on that and trying to figure it out themselves.
Hmm.
So I think we just have to be really careful about it. And I think in perhaps another situation it would be easier to test and go in and not worry about it. But I think when it comes to healthcare, it is just so sensitive and potentially life and death, right?
Hmm.
So
Hmm.
I don't like to take risks that are really, really unsure in that way and
Hmm.
how it would affect people because I know how my service works now and I know how it affects people now. And I can adapt and I can improve and I can add things and I can do different things with it. But think when AI is better understood in terms of its power,
Hmm.
potential, and regulation,
Hmm.
overall, that is the key right there is the regulation because I think people are there could be a lot of problems, right? If it's not
Right.
handled
If it's
properly. So I
correct.
think I think we just have to be very careful and very thoughtful around it
Right.
and have a clear understanding.
Yeah, I totally agree. I totally agree. So how do most of your new subscriber actually discover My 911 today?
You know what? If the Canadians, it's my911.ca, the website,
Hmm.
and my911life.com in the United States. And then we're all over social media. So we're on LinkedIn and Facebook and Instagram and X and Threads as
Okay.
well. So people can check us out there if they like.
Hmm.
And, if they have questions, they can just, contact us through the website, send me an email if they like, at info at my911. ca or info@my911life.com. And yeah, happy to have a conversation and share more about the story. And yeah.
Yeah, that's good. So what happens in the first 30 days after someone signs up?
Well, that the first, that's when they're really paying attention to get their information in the system to get, like, they take time. It takes time for some people to gather that information.
Hmm.
They may have to wait for information from their doctor. They may not have it all really handy. So it's about basically gathering the information and deciding what they want to put in their profile. And then once whenever they have that complete, they get to choose the information they're adding to the physical wallet card. And then when they're ready, they can send their card for printing. It might take more than 30 days, right? For them to
Okay.
get the information that they're looking for.
Hmm.
Some people have it all right away. Other people, their life is busy, right? So it takes them
Right.
a little bit longer to kind of get things organized. But once they're organized, it's pretty good. Like it's pretty easy. So, but I think, people, instead of trying to gather everything the
Right.
last minute to bring into the hospital, if they had somebody they were caring for and they didn't know their medications and they're
Mm.
carrying bags worth of medication into an emergency room, this is a much more simplified way of doing it
Right.
and
Yeah.
getting
Yeah.
things.
How long do you think it takes someone to update all that information?
You know what? I don't it depends. Like again, everybody is so individual and it depends what they're putting in there. So, it is just very individual according to the profile,
Okay.
you know?
It's not that like oh, I need to do it for like days. Because some of the forms are like really huge. It's just that's why I asked the question. Like at least typically, if it takes like 30 minutes, people will be like, "Oh, I can do it immediately," because you
Well, and you
can.
can do it in stages too, right? So you don't have to do it all at once. You're able to go back, you can spend,
You
15
can.
minutes today or you can spend 10 minutes today. And maybe you get most of it done. Maybe it takes you a half an hour. Maybe it takes you an hour based on the information that you want. And then you think more and you think, okay, well, I'd like to put in, my past surgeries and I want to make sure I put in caregiver instructions or something like that for
Hmm.
an elderly patient. So it depends what you're putting in, but I think it's important to take your time and do it properly and make sure that you're covering all of those questions that you're always asked because we're all asked different questions
Right.
according to our own medical situations. So what they ask you, Sirisha, is going to be very different than what they ask me, right?
Right.
And so it's going to depend.
Okay. Okay. So yeah, that makes sense too. And printing the card doesn't have to wait for everyone to finish their profile. Is that
Well,
right?
it depends what you want to put on your card, right? So if you have a heart issue, if you have, maybe there's epilepsy, maybe there's diabetes, maybe, if you have certain things like that, you're going to want to put those things
Okay.
right on your card, right? So that you don't have to print that out every time. So,
Mm.
like, explain it all the time. If you couldn't really, communicate well, you're going to want them to know you're a diabetic. So, those are the things that you put on your card are, the items that are not going to be changing on a regular basis. Medications might
Mm.
change. But specific allergies are going to be there that you're going to want to make sure that they're right on your card. So I would say that, take your time, make sure it's accurate, review it before you print it
Mm-hmm.
because they're all one-offs, right? They're all very individual cards. I
Right.
can't give you my card, right? It's going to be
Yeah,
different.
yeah.
So,
Right, right, right.
yeah.
I'm just trying to understand like how if I had to get one. I mean, fortunately, my hospital visits went down significantly. So I'm just
Mm,
thinking about because it's been 2 years I had a surgery. So hopefully I really
yeah.
hate the IV part of it. I hate
Yeah.
it. So yeah,
Yeah.
that's why I was like kind of asking about it. And if someone is listening to this and thinking about it, it needs to be as simple as possible. That's when
Yeah.
you get traction and people will be like, okay, let me get it. It's like some kind of insurance policy.
Yeah.
So it's
So,
right there.
yeah, and you're doing it in baby steps and you can do it, but people spend a lot of time on social media just scrolling and posting and liking this and doing that, like hours.
It
So,
becomes
I
an
mean,
addiction.
it's right. I mean, if they can do that, I'm sure they can go on their profile and update some information much, much faster.
Yeah.
and at least that is going to be something that will help them in the event of anything going wrong, or,
Right.
having regular appointments. It's going to save them a ton of time so
Mm-hmm.
that they don't have to fill out those forms. They don't have to answer all of those questions, right?
Right.
So I know it's different though, right? If it's social, it's different, just a different outlook.
Right.
But when it comes to healthcare, everyone, they do, they don't,
Mm-hmm.
but at some point you have to. So I'm trying to make their life much easier
Yeah.
so that they
I'm
can just
sure.
go back and scroll if they want at the end of the day. Right? They can be in the waiting room and scrolling on social, but they don't have to worry about organizing their medical information because it's already done.
I mean, how about like you are on the social media and promoting this
I
as
am.
an awareness? So that's like, that's what they get to see. And I think that
Yeah.
is a good way for someone, because that's where, see, that's where the meta ads came into picture, right? So if you're on Facebook or Instagram, that's where you advertise. It's just like before it was like a newspaper, and now everyone
Yeah.
knows that everyone is in the meta ads or meta
Yeah.
space, so they are taking like full advantage of the platforms. So yeah, there you
Yeah.
go.
And it's a great way to reach people and share updates. And, we also have the newsletter they can subscribe to. And
Mm-hmm.
then, there's other updates that we give through the site. Yeah, I think it's just where do you want to spend your time, and
Right.
what's important to you. So
Right.
it's prioritizing things. It's making sure that, they're taking care of themselves or in their, because health is important, right? Without it, we have nothing. So
Correct.
it's
Correct.
that should
Very
be number
true.
one. So
Very true.
yeah.
So one last question before I wrap. So where do you want to see
Mhm.
yourself next 6 to 12 months, in terms of your My 911 product?
Oh, just greater reach, lots of partnerships. Yeah, I'm excited to grow the business. I'm really excited. Just
Awesome.
to reach as many people as we can, obviously, and to help as many people as we can because the healthcare system is struggling.
Sure.
I've I hear so many stories, Sirisha, that it's so scary to be in some of these situations. And
Hmm.
if you can help people, why not, right? It's
Yeah,
a
I'm all
blessing
for
to be
it.
able to help them.
Yeah,
Yeah.
yeah, that's very true, Michelle. I know. I personally, before I went through my stuff, I didn't really care about that much. But after it
Yeah.
happened to me, there's like also, apart from the health, it's also trauma that you need to carry. So that is like the scariest part. It's like if it never happened to you and it's something happened, it's after the
Yeah.
fact. You need to get out of the trauma. You need to get out of how you pick yourself back again and do all your things, because with little children, or you have a family that you need to take care of, it's hard. I mean, there are so many people
Yeah.
out there who are going through this, and I'm like really appreciate that you did the unusual thing, and you built this product. I truly appreciate that.
Oh,
So
thank you so much. I appreciate it.
yeah, thank you, Michelle, for your time today and very insightful conversation. I'll just say thank you so much.
Well, thank you for having me again. It's been a pleasure speaking with you, and we look forward to helping as many people as we can and answering any questions anyone has.
Yep, thank you, Michelle.
You're welcome.